For the very latest on the fight against COVID, we are here with Dr. Abraar Karan. He is an infectious disease specialist at Stanford Health Care. Thanks for joining us today.
Thanks for having me.
Big changes here in California. Of course, a lot of the indoor mask mandates have been dropped, but not for schools. It looks like state health officials are not going to look at that until at least the 28th. Where do we stand when it comes to the efficacy of masks at schools? Do you think that's something we need to keep around?
Yeah, I think it's really important to ask these questions, right? Anytime you have interventions like this, you got to really wonder, do they work? Do they not work? Some people have pointed to the fact that we don't have randomized control trials that sort of look specifically just at masking, but we're in the middle of an epidemic. So we have to go with the data that we do have. CDC published data on this multiple times, but most recently in October 2021, they had an MMWR, which is sort of their top line report on masking in schools. They looked at counties that had mask mandates in place for kids versus those that did not in the school setting. And they found that schools that did have masks in place had significantly lower case rates of COVID than ones that did not have masks in place. So there is data to go off of to say that, especially when this is particularly important when you have high rates of community incidents, that masking in schools was associated with a lower case rate in terms of COVID. Now, is it going to be tougher with kids? It is. I mean, kids are going to have a harder time keeping their masks on. And, as more kids get vaccinated, we hope that they're going to get good protection from that, less likely to get any sort of complications from COVID or long COVID. And so, I think rather than what a lot of people are asking is when can kids unmask, the focus should be how do we vaccinate more kids? How do we get better ventilation in schools, better testing in schools, and get community incidence down? So when incidence is low in the community, then it's going to be low in schools. And I think that that's really the focus.
Okay. Meantime, on the other end of the spectrum, we see some of these, big event planners, Stagecoach, Coachella, um, dropping all of the precautions that we've seen over the last couple of years, not even requiring negative tests for entry, no masks. What do you think when you see something like that?
I think that part of this is sort of this big social push towards getting back to normal, what we had before the epidemic. And so these big headlines that we're dropping everything, and Denmark has sort of done the same thing. And people have made that comparison like, hey, Denmark's dropping everything. Why can't we? Well, Denmark is a very different place than the United States, right? The United States is, we have a very different system here, a different culture here, 50 different states, 50 different responses. There they had a contract saying, if cases start to go up again, we're going to have to bring back mitigation measures. That's going to be hard to do in the US, right? Just politically, it's tough to do that. And so I think there's this big push towards, and it's becoming a very popular take that just drop everything, let's get back to normal. And if you don't do that, you're kind of, just really taking a negative view on things. Well, as public health professionals, as infectious disease doctors, as people working on responses, for us, it's really look at the data, look at what the community incidence is. It's dropping fast. That's great news. But if we wait a few more weeks, it'll be down even lower. When I worked on the state response Massachusetts in 2020, when we had a test positivity rate around 1%, we had a pretty uneventful several months where epidemic outbreaks, big ones, did not start up again. So it's essentially when you have really low community incidence, then any activity you do is going to be lower risk. And we're getting there, but I think that waiting a few more weeks would have been important.
Okay. And of course, these big events are planned for later in the summer. Is this something that, we could just maybe watch and see, or do you have actual concerns
No, I think
for
it's
that
reasonable.
point?
I think it's reasonable to watch and see. I think it's reasonable to see what is the data, what is the community incidence. Maybe a lot of people have been infected to the extent that it won't be easy for another outbreak to take hold right away because there's just not as many susceptible people. A lot of these are outdoor events. Yes, they're close, they're crowded, but it's, as you mentioned, much later on. Let's see what the community incidence is at this time. I think it's hard to make big calls on future dates. Many of us have said, focus on the data, not the dates. If you stick to a date, then you're kind of stuck with that. And regardless of what's going on in the community setting, or if you then pull back, people say, well, you promised me X and you gave me Y. So I'd say, let's look at the data. Let's see what it shows. I think it's headed in the right direction.
Okay. Booster shots. At this point, do we know how long they are effective, or if we're going to be hearing about the need to get another round of boosters anytime soon?
Yeah, that's a really important question. Some countries have already started doing fourth doses for some of their higher risk folks or those who have higher exposures. We have not done that in the US. We don't have strong data yet to support doing that. Yes, we will see waning efficacy of the boosters over time. We've already seen that to be true. But with that said, we still have pretty good efficacy against severe disease and hospitalizations for people that have been vaccinated and boosted. We're not seeing a lot of those people requiring hospitalization. The few that are people that are immunocompromised and are coming in because they're at higher risk of progression, where we can give them other, therapeutics early on, like antivirals or convalescent plasma, that could have some effect to make sure that they don't get very sick. But I think in general, people that are getting very sick are still people who are unvaccinated. Believe it or not, there are still a lot of people in this country who are unvaccinated, and they sort of tend to be more so in certain counties, certain areas. Even within California, if you look at a map of vaccine distribution and uptake, it's a hodgepodge, right? And especially so with boosters. If you look at boosters across the country, long way to go for boosting. So I don't want people to lose sight of the fact that this is still important. We need to get people boosted. Otherwise, with reopening and low rates of people getting boosted, we could see more spread. I'm hoping not, but we certainly could.
And when it comes to getting a booster, is that something you would still want to get even if you've already had a case of COVID?
So it depends. I would talk to your doctor. It depends on how recently you've been infected. We do know that if you've been infected and you've been vaccinated with 2 doses, you still have pretty strong immunity. And so if you are sort of on the fence about a booster, talk with your doctor about your specific situation. I think it's hard to make sort of blanket statements on that. Natural immunity is a real thing. Of course it is. People who've gotten infected certainly have an immune response, and that is beneficial and helps to prevent ongoing reinfection. So I think it's really a case by case basis. But if you've had 2 doses, you've not been recently infected, then I think getting a booster is a prudent thing to do.
Because even with that natural immunity, we don't know how long that lasts.
Oh yeah, definitely. I mean, we don't know how long and to what effect, and how protective that's going to be over time. This does wane, and I think that we will see more COVID. It's a matter of time until we see sort of whatever the next variant is that is going to be thrown at us. And I think it's just really hard to make predictions on this. Being careful at this time is probably one of the biggest lessons that we've learned, right? These last 2 years, be prepared, be careful, hope for the best, be prepared for the worst. And I think that we have to do that.
All right, Dr. Abraar Karan with Stanford Health Care. Thanks for that.
Thank you.